Good afternoon everyone. I'm Dr. Priya Suman. I'm going to present on to study the association of HbA1c and serum lipid profile in diabetic retinopathy with CSME. There is no financial disclosure. According to WHO, diabetes mellitus is defined as when a person has more than 2 reading of fasting plasma glucose of 126 mg per deciliter or glycosylated hemoglobin more than 6.5%. Diabetic retinopathy is among the most common cause of leading blindness, affecting the age group of 25 to 74 years of age, and is a frequent microvascular complication of diabetes mellitus. It is classified into two categories, type 1 which is 10% prevalence and type 2 which is 90% prevalence. According to WHO, India has 70 million people living with diabetes in 2015, which is estimated to increase up to 90 million in 2030. The pathogenesis is there is loss of pericytes, which leads to capillary basal membrane thickening, leading to microaneurysm formation and further leading to the breakdown of blood-retinal barrier. The measurement of HbA1c has been reported to be one of the well-established means of monitoring glycemic control in patients with diabetes mellitus. It reflects average plasma glucose over the previous 8 to 12 weeks. It is being used as a diagnostic test for diabetes as well as screening test for person at high risk of diabetes. The elevated serum lipid causes retinal hard oxidate formation, which leads to endothelial dysfunction causing breakdown of blood-retinal barrier. My aim is to study the association of HbA1c and serum lipid levels in diabetic retinopathy with CSME. This is a hospital-based cross-sectional study which included all type 2 diabetes mellitus patients above 40 years of age from December 2022 to June 2023 in 120 patients. Detailed diabetic status of the patient included age of the onset, duration of the disease, any medication. Detailed ophthalmic examination included best corrected visual acuity, slit lamp examination of anterior segment, detailed fundus evaluation with indirect ophthalmoscope, slit lamp biomicroscopy using 90D, OCT, FFA. Blood investigations done in this study were HbA1c level, serum lipid profile, random blood sugar. In this table, highest frequency of patients belong to the age group 55 to 64 years of age, followed by 50 to 54 years of age. Out of 120 patients, 53% were male and 46% were females. In this table, highest frequency of patients were having duration of diabetes in 11 to 15 years, followed by 16 to 20 years. In this table, highest frequency patients were on oral hypoglycemic agent, followed by 24% were on insulin, 13% on lifestyle modification, and 2% were on oral hypoglycemic agent and insulin. This table shows 27% were having normal visual acuity, 23% were having visual acuity between 612 to 618, 21% have even less visual acuity, 624 to 636, 12.5% were having even less visual acuity. Majority of the patients were having venous engorgement, microaneurysm, followed by exudates, hemorrhages formation. Neovascularization was seen in very few patients. 95% were having random blood sugar more than 140 mg per deciliter. 25% were having normal blood sugar value. This table shows severity of retinopathy with HbA1c level. Less than 6.5%, most of the people fall in mild to moderate NPDR group, and more than 6.5% falls into moderate to severe NPDR. This table shows